Good morning, everyone, and welcome to the Engaging Effectively with Refugee Communities Forum 2024 and launch of translated health information for refugee groups. And I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your host for today, and we welcome you. Thank you so much for joining us. This is the second year that we're holding this forum online during Refugee Week and World Refugee Day. And this week is Refugee Week, which takes place on June 16th to the 22nd. And we're so pleased that we're able to hold this forum and have you joining us today. And this year's theme, again, is Finding Freedom. And this is the annual event that helps promote greater awareness of refugees, the issues they face, and the contributions that they're making in the Australian community. And today we're holding this forum for World Refugee Day, the international day to honor the strength, courage, and perseverance of millions of refugees who've been forced to flee their home country to escape conflict and persecution and in search for freedom for their loved ones and themselves. And we're here to hold the forum to highlight the importance of effectively engaging with refugee communities and promote refugee health, well-being through providing high-quality specialized health services and to provide important resources in refugee languages. And today, I am pleased to introduce to you our speakers who have joined us here online as well as here in the studio. So I'll start with Tish Bruce, who is Executive Director in Health and Social Policy Branch, Ministry of Health, who is joining us online. Tish, thank you for joining us.
Thank you so much. Lovely to be here.
Thank you. And we have here in studio Lisa Woodland, Director of the New South Wales Multicultural Health Communication Service. She's also the Director of Equity and Prevention Service in South Eastern Sydney Local Health District. Lisa, thanks for joining us.
Thank you so much for having me.
And with us today also is Cathy Preston-Thomas. She is the Acting Director of the New South Wales Refugee Health Service and a longtime partner of the service. Cathy, welcome. And we're so pleased to have Jeffrey Ma, Senior Manager, Humanitarian Settlement Program at Settlement Services International, also a good partner of the service and New South Wales Health. Jeffrey, thank you for joining us. And I would like to begin by acknowledging the traditional owners of the land from which we are all meeting today throughout New South Wales and their connections to land, sea, and community. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal people today. And we also want to say that we acknowledge the migrant and refugee backgrounds who have come from all over the world to make Australia their home and their contributions to its rich multicultural society. Today, we are launching 3 important resources that raises awareness about domestic family violence and relationships, which you will hear more about from our speakers and testimonial videos. The event is presented by the New South Wales Multicultural Health Communication Service in partnership with the New South Wales Refugee Health Service, Settlement Services International, and also funded by the Health and Social Policy Branch. And we want to thank the Strategic Communications and Engagement Branch for making this event possible. We have an exciting program. We'll learn all about the resources that people can use, but we want to ask you to, while you're watching there on webinar, please make some comments, post out some pictures from the session, and so that we could share that on our MHCS social pages on Facebook, Twitter, Instagram, and LinkedIn pages. You can use hashtag Engaging Effectively with Refugee Communities, a long one, but you could also use hashtag World Refugee Day or hashtag Refugee Week. To begin today's program, I would like now to pass the microphone to Lisa Woodland to talk about the project and why we're all here today. Lisa.
Thank you very much, Jess. And look, it's just it's a great privilege to be here on the panel today and to be joined by Tish and Jeffrey and Cathy and yourself, of course, Jess. Look, I also would like to acknowledge the traditional custodians of the land that we're joining from our various locations today. I'm joining from the lands of the Camaragal people of the Eora Nation, and I'd like to pay my respects to elders past, present and emerging, and extend that respect to Aboriginal colleagues who are joining us today. And like Jess, I would also like to pay my respects to people of migrant and refugee backgrounds who've come from all across the world to make Australia their home and really contribute in such an important way to our very rich multicultural society. So we're hosting this forum today to recognise the work and share the work undertaken through the Translated Health Resources for Refugee Communities project, which has been very generously funded through Health and Social Policy Branch through their Flexible Health Fund. And I understand Tish will be talking to us a little bit more about that later in the program. And look, the project that we've undertaken is really about increasing access to health information for refugee communities in their languages. We know that within the health system, often there's limited resources for translations, and we often get translations in 1 or 2 languages for refugee communities. So we're really here today to celebrate the fact that we've been able to, through the project and with the funding, translate into up to 21 refugee languages. It's a really remarkable achievement that we're really proud of. And of course, this aligns with the New South Wales Refugee Health Plan priority of effective communication in people's preferred language. So there's 2 resources that we'll be showcasing today, and they're really around critical issues for refugee communities. The first is around domestic and family violence, and the second is around safe and healthy relationships. And as I said, these are now available in 21 languages spoken by refugee communities. They're really designed in a way to meet health literacy needs and support access of refugee communities to healthcare. The resources are really important tools for health professionals, community educators, and service providers. And we really ask people to use them as a way of supporting conversations with people from refugee communities, especially women who are really, these resources are very important too. We've developed the resources in line with the best practice guidelines, which we launched here this time last year, which has been a fabulous resource and I know well used across New South Wales Health. The domestic and family violence poster was co-designed in a workshop with health professionals, community organisations and community representatives. And the idea behind the poster is that it's displayed in health services which undertake routine domestic and family violence screening, and it can be customised for those individual services. And the wording of the poster, the structure of the poster really reflects the lived experience of refugee women and recognises that health professionals are very trusted people to have a conversation with around domestic and family violence without a fear of being separated from their families as a consequence of that discussion. We also developed the resource as an audio-visual resource. And this was in recognition that, many people coming from refugee communities really haven't had the opportunity to develop literacy in their own language. So audio-visual resources are really important ways of being able to communicate in language and also to disseminate resources in a very sensitive and safe way for refugee women. We were advised by the community that providing links through places like WhatsApp and other messaging services, these audio-visual resources, which are hosted on like a preferred platform, which is YouTube, as I said, are a very safe and effective way of communicating with women about the supports that are available to them. We've also made the script available because we recognise that that's really useful particularly for community educators when they're talking to communities about these important issues. So we're very pleased to have Tish, Bruce, to launch these resources alongside the Relationship 101 booklet. So in closing, I'd just like to make a few thank yous. Firstly, to the Ministry of Health and Health and Social Policy Branch for funding the project, and Strategic Communications and Engagement, who support us in an ongoing way for these types of forums. Of course, thanking our project partners, our Refugee Health Service and SSI, and Family Planning Australia for their invaluable support and contributions to the success of the project. My thanks also go to the members of the advisory committee who've led the development of a range of resources over the past 2 years, and the members of the community panel for their exceptional contributions to co-designing the resources and also checking that the translations were accurate and culturally acceptable for their communities. A few more thank yous to the district and statewide multicultural health services and interpreter services who always support us in these projects, and of course to the Multicultural Health Communication Service team led by Jess for all of the energy and outstanding work they've done to deliver the project, with a particular call out to Nanette Costa, who's done an extraordinary job. So I just ask that everybody who's joining us online promote these resources to your clients and through your networks. And also just thank you everybody for your support and for participating in the forum today. So thank you.
Thank you so much, Lisa. And when we started this project, it was all about identifying resources to translate them into the 21 languages, and how we have grown and evolved into developing resources because of the consultations we've done with the community. And I think it's just a testament to how the community is able to come to us and to speak about what they need and for us to support them. So thank you so much, Lisa. I'd like to pass it on to Cathy Preston-Thomas, who is the Acting Director of the New South Wales Refugee Health Service, a key longtime partner, friend of Multicultural Health Communication Service, to share with us how the service had been, how they continue to work towards serving refugee communities and their health. And also a big congratulations to the service because it's 25 years. Wow, is that? So everyone clap for that. That's 25 years of amazing service for the community. But tell us more about what you've been doing and how the year has gone for you and the service.
And I'd also like to acknowledge the traditional custodians of the land. And I'd also like to talk a little bit about Refugee Day, which is the 20th of June. It's today. It was set up by the UN to celebrate 50 years of the Refugee Convention. It's now 73 years, I think, since the Refugee Convention. And the Refugee Convention has been such a fundamental document because it was a time where there was this global commitment to humanitarian good, where we all said after that. It was 1951, so in the aftermath of the Second World War, when people said, never again. And of course, at that time, people really didn't anticipate that there'd be so many global conflicts that were going to continue. Right now, there is more the refugee population. This year is set to be the highest number ever. We're seeing obviously conflicts in Gaza, in Ukraine, in Sudan, in Syria, in Afghanistan, and people escaping the DRC, Myanmar, and lots of escapes from repressive regimes where certain groups are targeted for persecution. So that is the context of the Refugee Convention and World Refugee Day. And the Refugee Convention set out that there'd be this one condition, this one exception to the rule of countries that they've got the power over their borders and they can accept who comes in. They said where someone has a well-founded fear of persecution as a refugee, then they can enter your country. And so the theme of this year's Refugee Week, we don't just celebrate Refugee Day now. In Australia, we've got Refugee Week. The theme is finding freedom. And this year's the theme is around the real focus on family. And so I think it's a really good time to reflect on the importance of Australia as a place that provides protection, and also to reflect on the commitment of families throughout refugee populations who, I guess as a parent, I've been thinking about all these examples, all the families who beg and borrow and all the money they can to get to smugglers to get children into safety. Those families who escape hardship, those families who were recently evacuated from Afghanistan, who spent 3 days in a ditch with their children trying to get out, those families who keep going and keep waiting and keeping their family together and their spirits up in a situation which must feel like there is no hope for years in refugee camps and in urban environments in asylum countries. And of course, all those struggles that families have in resettlement and that push and pull that families have with culture, trying to adjust and trying to motivate kids to do their very best and foregoing perhaps their own dreams for their children. Those are all these amazing sacrifices that we see every day. And so I think it's a really beautiful thing this year. So our service is it's 25 years, like you said, Jess, and that's been 25 years of working to promote and protect the health of people from a refugee background. And so we've been very much honoured to be working with many of those families as they've arrived, both as asylum seekers and as refugees as part of the, Australia's fantastic resettlement program, and working with our partners in SSI, Settlement Services International, to do on-arrival health assessments to make sure that people can address their health issues early, and hopefully, so one of the barriers, because we don't want one of the barriers to their success being their health. So trying to get people access early, providing that kind of specialist care around our disability support team, through our early childhood team, through a range of projects such as this one that we've been honoured to be involved with, to make sure that we can really benefit people. And we can't do that without the partnerships. That you cannot do that alone. And not just partnerships with other services, such as the Multicultural Health Communication Service and Settlement Services International, but also with our partnerships with people with lived experience. And that's why it's been so lovely to be part of this project, and the kind of real commitment to co-design throughout. And I guess we couldn't have done that without the support of the Ministry of Health and also Southwest Sydney Local Health District, who administers our service. And I guess one of the important things is, while we're a specialised service providing, while we specialise in refugee health issues, it is the responsibility of all health people, because these are our clients. These are often our staff as well, fantastically. But it is a commitment of everyone in health to give quality care. Thanks, Jess.
Thank you so much. And I remember when we started this, it was this discussion of how are we going to do this project? Let's think about it. And there was that talk of a funding that's coming up. And we said, okay, let's put it together. What are the partners, who we are? And it's come a long way. It's a few years now. And as we said, this is our second forum. And it is the responsibility of everyone to know what's going on and also know that there are resources available. So thank you for your service. And I'd like to say that we thank you for your team, for a close ongoing partnership. Want to give a special mention to Lydia Sestacoba, who had been working closely with us in this project for testing of the resources with your bilingual community workers. So thank you for that. Now, we did say 25 years. We want to watch this video message with Dr. Mitchell Smith, who was director of the New South Wales Refugee Health Service and is in another role right now with Southwestern Sydney. But he has led the team for 25 years. And here is a testimonial video for us to watch.
It's been a privilege and a pleasure to have led the New South Wales Refugee Health Service since its creation 25 years ago. The service has grown from a small group of 6 people to now over 40 dedicated staff. Back in 1999, we helped coordinate healthcare for 6,000 refugees from Kosovo and East Timor evacuated to Sydney. Over the years, we've continued to respond to international events reflected in refugee movements, including the Syrian and Iraqi conflicts, Afghans from Kabul, Ukrainians, and now people fleeing the horrors of Gaza. Our achievements include establishing a nurse-led model of care for new arrivals, clinics for asylum seekers without Medicare, a child and family nurse program, and a disability support team. We support refugee women's health and provide community education, plus training and advice for New South Wales Health staff. RHS has contributed to state refugee plans and other strategic processes. We were instrumental in setting up a national network of refugee providers known as RIANA and Refugee Health Nurses Australia. While I wish there was no need for a refugee health service, I commend respective state health ministers, the New South Wales Ministry of Health and South Western Sydney Local Health District for continuing their strong support for this important service.
Very much, Mitchell, and it's great to see from 6 to 40 and growing. Yes, and thank you, Mitchell and Cathy and your team for all the great work for refugee communities. All the best for the next 25 and 50 years. A key partner of the translated health information for refugee communities is Settlement Services International. We've worked closely with them and would like to hear now from Jeffrey Ma, Senior Manager of Humanitarian Settlement Program, to talk about their ongoing work and tell us the present situation of refugees in New South Wales at this time. Thank you, Jeffrey.
Thank you, Jess. I also want to acknowledge the traditional custodians of the lands that we are meeting today. I'm grateful for the care of the lands and the waterways for over 65,000 years. I pay respects to the elders past and present and any First Nations people here today. The SSI is honoured to be partners with New South Wales Multicultural Health Communications Service and New South Wales Refugee Health Services and funding body, Minister of Health. On this Refugee Week, we come together to pay tribute to the remarkable resilience and bravery of refugees from across the globe. At SSI, we are proud to work with approximately 20,000 refugees annually, where our goal is to support that search for freedom, peace, and happiness. Our goal is to empower them to rebuild their lives and create a brighter future. While we offer a range of programs and services to support our clients across the Eastern Seaboard, I'd like to highlight the Humanitarian Settlement Program, HSP. SSI is funded by the federal government to provide settlement services to refugees in Sydney and regional New South Wales, which covers Newcastle, Coffs Harbour and Armidale. As part of HSP, refugees receive support on arrival in Australia that includes airport pickup, short-term accommodation, community orientation, and health assessments. They are also assisted in finding long-term accommodation and providing a basic household goods package. New South Wales Refugee Health Services plays a vital role in delivering comprehensive health assessments to newly arrived refugees, ensuring that holistic approach in their health and well-being. We value our relationship and New South Wales Refugee Health Services, recognising their dedication and expertise. SSI's case management team model is a vital component of the program. The team includes case managers, bilingual guides, volunteers, and broader community. Case managers played a pivotal role in empowering newly arrived refugees to access essential services, including education enrolment, health referrals, and community engagement. Since the beginning of the financial year, HSP has provided support to over 3,300 newly arrived refugees. This is about 1,000 cases. The most common languages spoken by this group is Arabic, Dari, and Farsi. In terms of the family composition, the largest demographic consists of families with 3 to 4 members, followed closely by single individuals. So there's been an increase in individuals this financial year. The program continues to provide housing support to newly arrived refugees, but the challenges in the housing market conditions amplify the stresses, which is putting additional pressures on the program resources and operations. However, the impacts are greater for the refugees themselves. Some of these challenges include limited supply of affordable properties, higher rent prices, which does also impact the short-term accommodation, resulting in them resulting in harder and longer to save, taking longer to save money. Increase in single cases, actually, requiring complex negotiations for shared accommodation arrangements, and landlords preferring applicants with stable income and tenancy history, making it harder for refugees to secure a lease despite our connections with real estate agents. Whilst we have challenges with housing, the project to translate essential health resources is a great asset to refugees and has assisted in improving SSI's ability to provide health services to refugees. Individuals from refugee and refugee-like and asylum seeker backgrounds often face challenges accessing health information in their preferred language. Additional barriers include difficulties, finding relevant information, limited literacy in their native language, and lack of multimedia resources, such as videos and audio recordings. These obstacles hinder their ability to access and understand vital health information. That is why the Translator Health Resource Project has been so crucial. In the previous year, SSI collaborated with MHCS to enhance the resources by identifying the language spoken by refugees, prioritizing health issues, analysing barriers. Notably, many SSI staff members within the diverse HSP workforce have personal experience settling in a new country, having come from refugees and migrant backgrounds themselves. This unique understanding enables them to empathise the challenges faced by new arrivals. This year, we built upon our previous efforts and achieved a review on today's the resources and the co-design and consumer engagement poster, which was presented in the development of, in National Multicultural and Health and Wellbeing Conference in Sydney to showcase the development of the CALD health resources. In September 2023 last year, the MHCS publications language page was linked to our MySSI app. So the MySSI app was created to give our HSP clients extra support during this year, during the first year of settlement. The app comes in English, Arabic, and Dari, and has over 280 articles covering different topics, such as housing, health, education, and employment. In our articles, we have included information from government and non-profits. These highly credible sources are important in this age of misinformation. An example of an article called Health Resources in Your Language, we have links to resources compiled by Multicultural Health Communications Services. For example, under cancer, we have links to brochures and videos in Assyrian, Dinka, English, Kurdish Kurmanji, Pashto, Somali, Swahili, and Tamil. Where the resources are available, we've included easy read English for our clients, learning English and those who need more support. We want to empower clients by giving them access to information created by our partners and the languages and in English too. Within various articles, other illnesses and diseases, we have links to the New South Wales Health website, the New South Wales Health Education Centre Against Violence, the Transcultural Mental Health Centre, and others invested in migrant and refugee health. There are also links where our clients can search in their language in the Multicultural Health Communication Service website. In an article on domestic and family violence, we have embedded videos from the newly released There Is No Place for Domestic and Family Violence in Australia series in all languages relevant to our clients. There are currently over 900 onboarded users and growing with 13,000 views on articles. The app is under daily development and improving in continuing to grow its functionality. Our hope is that we can continue to grow the MySSI app and continue to improve the support for refugees. To achieve successful refugee outcomes, SSI recognises the value of collaboration with the broader community and stakeholders. This partnership demonstrates, the impacts we can have when we work together towards a common goal in improving the lives of others. I would like to extend the gratitude to Multicultural Health Community Services, Jess, here with us, and Refugee Health Services, Cathy, and the Minister of Health for the dedication to making the partnership possible. By working together, we can create a cohesive community approach that supports successful integration of new arrivals. Thank you.
Thank you so much, Jeffrey. And, hearing that 3,300 cases and noting that those are the languages that we've developed, I would want to thank you to you and your team. A big thank you to a mention to Munez Mansoubi and Amitabh Rajoria, who has been working so closely with us. And I think every advisory committee meeting, we're able to have really good discussions and how we can develop more resources and how we could do more things for accessibility. And thank you for the app that you have now and where our resources are now being seen there and health information for all communities, refugee communities, as well as all multicultural languages. So thank you so much for that. Let's watch this video now from one of your team members, Jeffrey, Feruze Daranan. She's a Humanitarian Settlement Program Case Manager from Settlement Services International, to tell us how important the in-language resources on domestic family violence is going to help communities. Please watch this.
My role involves working with newly arrived refugees, including people with disability and women at risk. I've been part of the Translated Health Resources for Refugee Communities Advisory Committee since 2022. I was involved in consultations and developments of the domestic and family violence poster and in reviewing translated materials in Farsi. For SSI, this project has been invaluable. It provides us with translated health resources which have a positive impact on the lives of our refugee clients. Many refugee clients may not recognize domestic and family violence in its various forms and that it is illegal in Australia. The audio and video resources will be beneficial for everyone, especially victims of domestic and family violence, knowing where to get help and support.
Thank you very much to SSI for the team there, and to Feruze. And we have had her on the project as well for the support. We want to thank you and all the SSI bilingual community representatives who have reviewed the resources to ensure they're culturally and linguistically appropriate. As Isa mentioned, for the domestic family violence resources, we ran consultations, co-designed resources, and we want to give a special mention to Ava Pruchard and Venus Concessis from the domestic violence team from Southeastern Sydney Local Health District, and also to the Prevention and Response to Violence, Abuse and Neglect, or PARVAN, from the Ministry of Health for their support and guidance in how we are able to deliver those posters to to health services. And now one of the resources being launched today is the Relationships 101 booklet. It is now available in additional languages. We're so pleased to have partnered with Family Relationships Australia for this resource. Let's watch this video by Elin Chang, Manager Health Promotion, Family Planning Australia, to speak about how valuable these resources are for young people from refugee communities. Let's watch this.
In 2021, with funding from New South Wales Health, we developed the Relationships 101 booklet with young people in southwest Sydney to help make sure that young people from diverse cultural and linguistic backgrounds have the information they need to make informed decisions about their relationships. We translated the booklet into a few languages initially, so we are very pleased that in collaboration with the New South Wales Multicultural Health Communication Service, we are now able to offer this booklet in 21 community languages. Our message to refugee communities and the broader community is that every person has the right to enjoy safe and healthy relationships. If you have just started a new relationship, or you're thinking about having one in the future, now is a great time to read our Relationships 101 booklet.
much, Elin and her team, and for all the support and with the project. We're so pleased now that the booklet is available in the additional languages, 18 languages, and then Elin and her team have said that they will now also run in language sessions in those additional languages. So they were in just a few languages, and now it's amazing. So I think that's going to be reaching more communities in the future, and we never know, more languages to come. So thank you for that. Those 3 videos that you've seen today, they will be online on our social media platforms and on our website. So we'd love for you to share that on your social media platforms as well, and to share with your networks to highlight the work of Refugee Health Service, the work of SSI, of Family Planning Australia, and all the resources that we're launching today. It is now my pleasure to introduce Ms. Tish Bruce, Director of the Executive Director of the New South Wales Health and Social Policy Branch at the Ministry, to speak about the Refugee Health Flexible Fund and to officially launch the translated resources. Tish, thank you so much for all the support of your team and your guidance in this project.
Look, thanks, Jess. It is our absolute pleasure to be part of this sort of work. And to join you all today for this session. So thank you for the introduction. I'd like to acknowledge Lisa, Cathy, Jeffrey, and all your hardworking teams for the contributions to the Translated Health Resources for Refugee Communities project, and for bringing us together today for this important forum. It's so important we stop, acknowledge and celebrate the work we do across all of our different areas, and then make sure that it's broadly known to the people across New South Wales that these fantastic resources are available and are ready for use. I am coming to you today from the land of the Gadigal people of the Eora Nation. I acknowledge that we're meeting on many lands across New South Wales today. I also pay my respects to elders past, present and emerging, and extend that respect to Aboriginal colleagues joining us. I also pay my respects to people from migrant and refugee backgrounds, and acknowledge our rich multicultural society, which I think we collectively treasure. I think it's an extraordinary place to live in Australia and to have the richness and diversity that we have, and that just makes us, I think, such a strong community. I thank the Multicultural Health Communication Service for hosting the forum today, and recognise and share the work undertaken through the Translated Health Resources for Refugee Communities project. As we heard from others, and particularly from Cathy today, each year on the 20th of June, the world celebrates World Refugee Day, and the international day to honour people who've been forced to flee their country of origin. And as we heard, this day falls within Refugee Week, and it's appropriate we take a whole week to recognise and think in this space, and to look at how we can honour the work that's been done, honour the people that it relates to, and also think about what we need to consider for the years to come. This year, as we said, the theme for Refugee Week is Finding Freedom, and it focuses on families and their journeys of resilience and strength and unity in the pursuit of life which offers safety, security and freedom from persecution. Through the New South Wales Refugee Health Plan 2022 to 2027, New South Wales Health affirms our commitment to meeting the health needs of people from refugee backgrounds in ways that are culturally responsive, trauma-informed and strengths-based. And supporting people from refugee backgrounds by addressing health needs of individuals and their families is a really critical part of helping them settle in New South Wales and Australia, and builds a platform for them to thrive and flourish in their new home. There are many parts to the plan, but one of the cornerstones of delivering the plan has been establishing the Refugee Health Flexible Fund in 2021-22 and 22-23 to identify and support ways to embed culturally appropriate and tailored healthcare for people from refugee backgrounds across New South Wales. And through this, an enormous diversity of work has come forward, and I think being able to do it through a funding pool has allowed the response to the understanding of the local needs and the collective needs, being able to consider things at a statewide level, but learn from communities and what is emerging and what's important at this point in time. So it is a real way to respond through a hearing of communities and the local service providers who are working with those communities. So the fund supported 15 projects which have addressed, as I said, statewide and local needs, and they cover a really diverse range of health priorities. And so that's included things like cancer screening, oral health, treatment for torture and trauma, mental health and emotional wellbeing, chronic disease management, and digital health literacy. And it's also funded supports for the development of tailored models of care for refugee communities, particularly in child and family health settings and in regional areas of New South Wales. The Translated Health Resources for Refugee Communities project, which we've been talking about today, addresses the health literacy needs of communities by providing the health information in up to 22 refugee community languages. And as we've heard, it's so important that we're focusing on the languages of people arriving within Australia, as our broader translations often don't pick up those newly emerging or smaller community languages. So to reach out to 22 community languages is both important and impressive. So congratulations to New South Wales Multicultural Health Communication Services and the partners for all the work that you've done to ensure the delivery of this important and high quality project. I'd also like to take the opportunity to thank and congratulate staff and volunteers across New South Wales, both within New South Wales Health and also in all the services we partner with, for the important work that you do to address and reduce the impact of health inequalities experienced by people from refugee backgrounds. This work that happens on a day-to-day basis is just so critical to ensuring that people are welcomed and, as we said, able to thrive and flourish within New South Wales and Australia. It's my absolute great pleasure to officially launch the Domestic and Family Violence Resources. There is no place for domestic and family violence in Australia in up to 21 languages, and the Family Planning Relationship 101 booklet in 18 languages. I really encourage you all to download these resources from the Multicultural Health Communications website and to share them as widely as you possibly can within your networks. People knowing that these are available is so important, and it's all of you who actually help us communicate that as widely as we can across New South Wales and across the broader Australia. Together with communities and partners across government and non-government sectors, our work in addressing the health needs of refugee communities is one of the very important contributions we make in helping refugees find their freedom. So I'd like to thank you and launch the resources today.
Very much, Tish, to you and the Health and Social Policy team for all your great support. Thank you for launching the resources. We'd like to also give a special mention to your team who supported the Refugee Health Flexible Fund, Nick Sandraco and Ilse Vinalt, for their guidance with the funding project. We also now want to watch and play the English version of the domestic family violence video entitled "There is No Place for Domestic Family Violence in Australia," which is available in 20 refugee languages. That is now available on our New South Wales Multicultural Health Communication Service website. And as Lisa mentioned, we're allowing multiple ways of accessing this. There's a transcript, there's an audio version that will come out, but this is on YouTube as well for the video, but there will also be in language where it's subtitled. And you can see in the video that it entitles what language it is. So let's watch this video now. There is no place for domestic and family violence in Australia. You and your family are protected by the law, including new migrants and temporary visa holders. In Australia, domestic and family violence is illegal. Does your partner or family member make you or your children feel afraid? Do they hit or hurt you or your children? Do they expect you to have sex even if you don't want to? Do they insult you? Do they stop you from having your own money? Do they stop you from going places or seeing people? If this is happening, you could be experiencing domestic and family violence. To seek help and support, call the New South Wales Domestic Violence Helpline on 1-800-65-6463. It's free and available 24 hours a day, 7 days a week. To speak to someone in your language,
call the Translating and Interpreting Service on 131 450. Say your language. Ask them to connect you to the New South Wales Domestic Violence Helpline on 1-800-6564-63. If you or your children are in immediate danger, call 000 for emergency services.
And that video is available in all the other languages as well on the New South Wales Multicultural Health Service website on YouTube. And if you need us to send that through to you, please let us know. We will be sending out the recording of this session as well as links to the resources in the next few days. So we will now open the panel discussion. Would love you to ask your questions online, put it on the chat so we can ask the questions with Jeffrey, with Lisa and Cathy, as well as Tish here today. So I just wanted to ask everyone today in terms of consultation. When we did this resource, we wanted to thank SBS in language also for the collaboration that we did in developing this resource and making it accessible. And there were back and forth, of course, and then also testing it with the Refugee Health Service and with SSI. I guess the co-design factor in consultations, that is key in effectively engaging communities, refugee communities, and also noting that it is a two-way conversation, isn't it, Lisa?
I think the emphasis on the co-design is so very important. We know that health professionals bring enormous expertise, their evidence base, and that's so very critically important to the health information that we deliver to communities. We also know that communities bring lived experience, and community organisations that work with communities are really, really close to that. And so I think by bringing these three groups together, really understanding the evidence, understanding the experience, and also understanding how communities interact with community organisations and how we frame information so that it's accessible, but it's also acceptable. Refugee communities often have very different experiences to other communities in Australia. And so we need to nuance our language, nuance our approach, and really make themselves be seen in the resources that we develop. So that's why I like the co-design. Yeah. So not sure if others would like to add to that.
Yes, and Cathy, we remember that it was based on the consultations that we did in the initial part of the project when this came about about domestic family violence, that there was no resource around in languages, but also just a simplified version, whether it's a poster or a fact sheet or audiovisual resources.
And obviously it's an area which is, of course, it can be a very new concept, this protection, domestic violence protection. So it can be, it's a really important thing to be able to explain kind of regularly and in different means. And I know that in SSI, you deliver information about domestic violence in your sessions when people newly arrived, but people need a range of modalities as well, because we never know the timing as well. And when people arrive, they're really often quite overwhelmed with information and maybe not sleeping so well, worried about family. So the timing of information, having something available when it's needed is really important as well. We can't just rely on education sessions.
And Jeffrey, Feruze already said that in her work, it's crucial that resources like this, they can share.
Yeah, I think it's important because it is a very, new. Domestic violence is new for some refugees, and I think just opening that simple translated resources, like just that basic messaging that it's not acceptable in Australia, I think that opens up dialogue and also courage for people to speak about domestic violence as well. So I think for the case managers, I think these resources add value to the day-to-day work and actually, allow conversations to occur with their clients or with new refugees.
Thank you, Jeffrey. And if you have any questions, please pop them on the chat now. We have Lisa, Cathy, Jeffrey, and Tish to be able to answer your questions. I wanted to ask Tish, we have set in New South Wales Health a multicultural and refugee advisory group, and that's so important, just to bring people together so we know what's happening across the state.
Yeah, thank you. It is really critical that we have these sort of statewide steering committees and advisory groups to actually ensure that we do as, it's not quite in the co-design space when we get down to the detail of projects and actually working through exactly how it works for individual communications, but it absolutely sets us to ensure that the work that we're doing is heading in the right direction, that there's we have multiple inputs and voices at the table that talk to the different needs and experiences of all of the work that we're doing across New South Wales. There is finite resources for people, just time and energy. So you want to make sure that the work that we're doing is the work that's going to be most impactful. And through those advisory groups, we get to get feedback about is the work that's being done impactful? Is it in the right place? Is it done in the right way? And we sit in a space with many people from different perspectives, which actually kind of, we talk in other places, but it's actually the hive mind. It's all of those perspectives that means that we actually do better together rather than assume from one point any one of us knows it. So we value those types of forums and groups to ensure that we are doing the best we can with the results we have.
Tish, and we've launched the resources, the video, and also the poster for domestic family violence, but Family Planning Relationship 101 booklet also came from a consultation from Refugee Health Service, where we said, look, it's available in some languages, but it's not available in others. And we've developed it now in 18 languages, and that means a lot. Because young people that come in, and you would know this, who come from refugee, from their homeland, they would not know about relationships. How do you deal with this? And it does lead to domestic family violence if you're not aware of how to deal with relationships. Cathy and Jeffrey.
And yeah, look, I have to have a shout out to some of my staff, particularly Bian Echeverria, who's our fantastic refugee women's health worker, and Lydia Sestakova, who's our health literacy manager, for raising this issue and being such great advocates. But yeah, and I think particularly now that there's more discussion around coercive control legislation as well, there's going to be lots of questions in the community. So it's really important to start what is that kind of discussion around what is a healthy relationship.
Thank you, Jeffrey. That's these are sessions that's going to be held in your facilities as well.
Yes, I think we do have a lot of youth that come through the program. So I think this one-on-one booklet, it's going to come through our orientation, through our case managers, through the app. So there's going to be means to support youth and young people. I just access this information just to have, I guess, conversations with the case managers around it.
Thank you. There is a question from Sasha Fenton. Hi, is the MHCS, Multicultural Health Communication Service, interested in translated
health resources developed by academics? And I'll pass it on to Lisa as a question, but also just some thoughts.
I guess we're always interested in translated health resources because we know how very important they are in terms of communicating with communities. We do bring a lens to the resources that we develop and we promote, and that lens is around health literacy, to ensure that the resources that we promote are at a reading age that is actually appropriate for the community, and also that they're culturally appropriate. We know that there's lots of translations, for example, that are done overseas, and the language context might be very accurate, but the context for communities living in Australia may not fit. And so we're just very open to working with a whole range of partners around developing resources that are actually sort of done in that sort of best practice framework with those sorts of concepts in mind, because we know how very important it is that the information is accurate, but it's also accessible and acceptable. I think that's really important. And, you know, the last thing we want to do is lose confidence with communities if we don't have all of those things in place. But very, you know, welcome any conversations around that.
Yes. And I think, Tish, going back to you in terms of the refugee health plan that's been launched a few years back, and the culturally and linguistically diverse plan as well from New South Wales Health, this is what we strive towards, information that are accurate, that are accessible, and that are just thought of well, so that we, as you said, we bring together lots of people to make sure that the message or the resources that go out are going to be used and are not going to lead to misinformation.
Thanks, Jess. Absolutely. And I think Lisa's point around making sure that they make sense within the context of Australia, both the culture of Australia, the legal system, our service system, and are I think that we've built an enormous capability within New South Wales across both our non-government and government services and many other areas like SBS to really think through how to communicate in diverse and different ways, and to make sure that can land for different people. So I think this way of looking, bringing in ideas from breadth, looking at the needs that are there, and then making sure it actually responds to the communities that we're talking to and works for the provider sector as well, is so important for us. Like it's the core thing, and everybody on this forum knows it, but communication is what builds societies, and being able to communicate about critical things, as Cathy said, at the right time in accessible ways. And so all our efforts in the multitude of ways that we communicate is just foundational to us actually being a strong, knitted, supportive community.
Thank you, Tish. There is a comment from Ibtisam on the chat. Great resources, relationships are complex, and as you say, Lisa, must be nuanced, particularly for practicing Muslim women experiencing domestic and family violence, where they may seek religious guidance as well. I know that many imams are speaking out against domestic family violence, and their support is important for women to remain connected to their communities. Thank you so much for that comment and sharing that with us, Ibtisam. And we know how important these resources are. We've just started. There's a lot of things more to do and a lot more resources that we need to be building, and so I guess that's why we are grateful for the funding that's been provided by New South Wales Health and the Health and Social Policy Branch, and we hope that there would be more of that in the future, Tish. But in terms of funding, that is crucial. I guess we're all of our organizations, we want to be able to do resources, but that's why we're partnering with each other. And how crucial are partnerships in where we're doing now and where we work at this time, Jeffrey?
Yeah, I think there's so many gaps in resources and I guess information in the community. I think this space is just so much room to grow and develop resources. I think it's essential to adjusting to the different types of refugees that come through to, like, it's just forever changing cohorts. So I think it's important that we continue this project if possible.
And whenever there's a gap in information, it means there's an information vacuum which gets often filled by the risky information that may be filled with misinformation. So there is a really strong impetus for us to be really proactive, and we can't do things alone. Sometimes it's a resource thing, but also a lot of these issues, particularly looking at the social determinants of health or some of these broader issues that touch not just health, but also education, settlement. It doesn't require just one service taking responsibility. you weaken the resource that way. You can target, make it bigger and more effective if you're all talking from the same song sheet, perhaps. If you use that.
Thank you, Lisa.
Oh, look, I just, echo and value everything that Jeffrey and Cathy have said about partnerships. And it shouldn't be underestimated how important they are, how valuable they are. And yes, time and energy and lots of conversations, but that's really about building a platform for the future as well. And it's about reach into the community. And together we can actually do so much more because of those shared resources, shared commitment around doing this work. And look, the other thing I would just like to add, which I think is so very critical when we're talking about refugee communities, is the issue of trust and trust in government. And we know that for many refugee communities, that trust has been broken. And so by providing good information to refugee communities in a culturally appropriate way, in language that they connect with, is showing our respect and demonstrating that we are worthy of their trust. So I think that's a really important thing to think about when we're talking about Refugee Day, Refugee Week.
Yeah. Thank you. We have run out of time, so it's 11:31. But thank you for sticking around. But we just wanted to go around the room and online for some last words and bidding farewell, and anything you'd like to say, Tish, to the group, to the media, to the community, to all those health workers that are joining us today.
I'd just like to thank you all for joining us today. Thank you again for the enormous efforts and ongoing work that you do to support migrants and refugees, for, I think, recognising it is partnerships and collaborations, and that helps us do the reach and not waste our efforts, but do them together. So I think the more we can do this, the better it is, and it's my privilege to be part of it.
Thank you very much, Tish. Jeffrey.
Yeah, thank you for this opportunity. And I guess the resources themselves do come back and provide us feedback. And I think it's something we can work together as well. So yeah, thank you.
Thank you, Jeffrey.
And I guess I'd like to just offer this partnership to all the people listening as well. Now we need to all work together to try and get these resources out. So yeah, I thank you for if you could, keep share them with your networks. That would be great.
Thank you. Cathy, Lisa.
Look, I just echo everybody else's words. I think everybody, you've said it all. It's been a fabulous partnership. We really want to continue, and we really want people to share the resources. So that's a critical part of all the work that we've done. So thank you for that.
Thank you. Jeffrey, Cathy, Lisa, and Tish, and to all watching us. And that concludes our Engaging Effectively with Refugee Communities Forum 2024 and the launch of the Translated Health Resources. And we hope to see you again in 2025. But thank you to all the speakers, to the Health and Social Policy Branch, New South Wales Refugee Health Service teams, the Settlement Services International, Family Planning Australia, Parvan, Southeast Sydney, Local Health District Domestic Family Team, the Multicultural Health Services across New South Wales, the Health Interpreter Services as well and their teams, and also the Strategic Communications and Engagement Branch for the Ministry of Health. We thank you for all your great support with this project and today's forum. To Mitchell, Farouze, and Aileen, thank you for the time and the filming of those videos. We want to thank the videographer, Ali, for also supporting us with this project. And all the videos you've seen today, they will be online on the social media platforms. The recording will be available for you. We'll send out and flog your emails with all the resources, but we want you to please share them with your communities and go on to the Multicultural Health Communication Service website and our YouTube page. We invite you to like the Multicultural Health Service social channels and use hashtag Engaging Effectively with Refugee Communities or World Refugee Day, hashtag Refugee Week. I would like to also thank the people who worked hard to put today's forum together. For those staff who worked hard on this project to develop and promote the resources over the years, especially our MHCS project officer, Nenette Costa, for all her work in coordinating this project and event. I would like to thank our MHCS team, Lisa Woodland, for your leadership. Thank you so much. Our amazing team members, Rajan, Monica Raja, Gia Chow, Tamiam, Basuda Karki, Napam, Heidi Han, and Glyza Perez. And of course, we cannot go without acknowledging our former colleague, Sylvia Giannoni, who set up, who was a project officer who started this initiative together with the support of our colleague, Gaia Dharmagesan. The recording of this launch, as I said, will be available soon and shared with you. Thank you all for being with us today. We're really grateful that you've joined us, taking the time, and also to make sure that we remember World Refugee Day and Refugee Week. I'm Jesusa Helaratne. It's a privilege to have shared the time with you today, with all the wonderful speakers and the resources. Please share them on your socials and networks. Thank you. Have a good day. And remember World Refugee Day today. Take care.